Hello, everyone. So, this doctor, he reported and warned about the deadly virus, and he is now a victim. Unfortunately, it's sad to say he's a victim, and he died of this virus himself. So, doctor who tried to warn people about the coronavirus has died. So, this is by Corin Miller, and this virus is a lot worse, it seems like, than what they made it seem like in the beginning. In the beginning, they kind of were slow to report on it. And as the numbers started to grow of the people that were dying in China, it started to come out more and more the concern from people. And I had said that there was a woman who I knew, she worked for LAX, and she said she was really concerned because she's seen a lot of travelers, people coming with the mask on. And so this doctor, I guess he had probably came in contact more than likely with the virus, and he warned people, and he posted a message on social media sites, and he tried to warn people about how severe the virus was. He was 34 years old. He first made news after he was punished for making the report. So anyway, let me read how the article is read, because this is just probably giving the same thing as the article, but it says this Chinese doctor who was one of the original whistleblowers on the coronavirus has died himself, according to the New York Times, the Washington Post, and ABC News. So earlier in the day, Wuhan City Central Hospital, where Li Wenliang was being treated, said that on the Chinese social media site Weibo, that doctors were were trying to save him. Okay, so the 34-year-old initially made news after he was punished by the Wuhan police for alerting people about the coronavirus in its early stages. So Michael Ryan, the PhD, the executive director of the World Health Organization Health Emergencies Program, shared his condolences on Twitter. And we are deeply saddened by the passing of Dr. Li Wenliang. We all need to celebrate the work that he has done. So that's hashtag 2019 NCOV, he wrote. So this was the doctor, and I think I had a photo of him because when I started talking about this virus and talking about the woman from LAX, how she had concerns because she didn't want to bring home that germ to her family. She's concerned if she might have something on her clothes because she's in frequent contact with the different people traveling in and out of the different places and the regions. So, two, I heard from someone recently on social media that responded to one of my videos, was saying that they had put like a closure on the traveling, and and basically they've been quarantining people who they suspect might have come in contact with the virus, and then people also that travel from the epicenter of where the virus outbreak had originally occurred, and people that are coming into the states, and so that they may have tried to shut the borders down for fear that people might come in contact with this virus. So it is pretty serious, because it was like 300 and over 300, and then it jumped from 300 over 300 to 400, and now I'm not even reporting how high the numbers could be now, but it seems as though people are dying of the virus. It's pretty serious. I don't know if it goes in stages or what. I know some people had talked about it, said that they were trying to find where it may have come from. Some people said that they had that it was a type of food, exotic food like bats that was being eaten or being consumed in some type of way that actually carried a similar or the very same virus, and that it was passing from that source, that food source to humans um, that were consuming that. Um, what I noticed is that some of the street food, some of the cultural foods in some of these countries are like really exotic, and there might be live food, not cooked, and a lot of times, or if it's even if it's cooked, it's something that's gamey and wild that may not really have any nutritional value whatsoever and could possibly have parasites or some viral something. And so, from what some other sources have told me, that it had to do with bats. And so, some people were reading about it. I even heard some people talking about it earlier today, saying that the person actually um, will cook or boil the bat, and then they suck the bat, and then they invite a guest over, and the guest gets to have the head of the bat. I don't know if I heard that correctly, but when one person hears something, it passes to other ears, and then it may be told differently. So I'd have to really do the research on that. But from what I know, is they say it comes from people that are eating or consuming bats, and it's in the uh, Asian country where I guess it's a delicacy, or maybe just I would assume maybe another exotic food, um, and so it just seems really crazy, but when one person gets sick, then it passes from that one sick person or those other sick people to other people. And so they said it's easily transferred once people become ill. So anyway, going on with this, it says that it is normal for someone of Lee's age to develop a severe form of the virus and possibly even die from it. So he was 34 years old. He's very young. Experts say it's unusual, so preliminary evidence suggests that older adults and persons with underlying health conditions are at higher risk of severe disease and death. So, Associated MD, Richard Watkins, MD, an infectious disease physician in Akron, Ohio, and an associate professor of internal medicine at the Northeast Ohio Medical University, tells Yahoo Lifestyle this. So, however, experts say that there is still a fair amount of that they don't know about novel or the novel coronavirus, which was only recently found to infect humans. So we still don't know very much about the age distribution and the most serious case of death. William Schaffner, MD, the infectious disease specialist, and somebody's talking about something that's unrelated. Okay, the specialist and professor at Vanderbilt University School of Medicine tells Yahoo Lifestyle, so like a flu and other respiratory illnesses, though, it's possible for otherwise a healthy person to die of the coronavirus. Infectious disease expert Amesh Ajla, so I may not be pronouncing it correct, but I think that's where the fear is coming in, because you could be a person that is a healthy person and die of this virus. And so that's what's got people really talking, because here you are, you're thinking, you can understand somebody that's got other underlying diseases, or maybe they're sick with something else and they could be easily infected and succumb to this. But for a person that's of good health to also be at risk for dying, that's what scares a lot of people. And the transmission, from what I heard, is not that hard to get it. So the senior scholar at the Johns Hopkins Center for the Health Security tells Yahoo Lifestyle it's certainly not impossible, he says. So are doctors more likely to get severe cases of the coronavirus? Not necessarily, but they're more likely to actually contract it Watkins says, so clearly this is spreading in the community in China, and the doctor there is going to have more intimate contact with the infected person than someone who is not a doctor. And so that's another thing that scares people, because if you're in the profession of working in hospitals and clinics where people come to get medicine or they're sick with something, you're going to be in more direct contact with people who have this virus, and also people who work in environments where there's a lot of travelers who may be sick with this virus and in the early stages of it. And if you're in crowded areas, like where, it could be the grocery store, it could be a shopping mall, or it could be a theater where somebody's sick with this, or it could also be the airports and getting on a plane with people who are sick with this virus, and they're coming and going from these different places where people are infected or heavily infected. So based on the latest data, the coronavirus has about a 2% mortality rate, meaning that about 2% of the people who are officially diagnosed with the virus have died from it. However, Schaffner stresses that the real number is likely much lower, he says, but we don't know exactly what the death rate is because we don't know about all of the milder cases of coronavirus. He says people with a milder symptom aren't getting tested right now, and the mortality rate appears to be lower than SARS but higher than influenza, but we don't know for sure. And so some people say they think flu is more of a danger than this virus, so we don't really know. I think this is still a developing kind of story. What I do know is they mentioned something about bats. Okay, so, and then people probably wanted to look it up, so I was gonna take it upon myself to find out. Okay, all right. The Chinese doctor who tried to raise alarm on the coronavirus, he dies on the front line. Oh, okay. Coronavirus, third UK patient caught coronavirus in Singapore. Coronavirus live update, Wuhan rounds up the infected as the death toll. Okay, so this is 23 minutes ago. Okay, so since we're on the subject of this, why not find out what's going on here? I'm almost afraid to find out what the report is going to say, because this one right here is pretty serious, because it's talking about the death toll of the numbers of people. So the coronavirus live updates, Wuhan rounds up the infected as the death toll is climbing again. So the mass quarantine was ordered in the city at the center of the outbreak, but it's not clear if the authorities there would be able to provide even basic care. So more than 70 more deaths were reported in China, and the doctor who warned about the outbreak was silenced. And so we heard about that. He was silenced by the police and was among the victims as well. So the death toll in China surpasses 600 now. It was 300, then it was 400, now it's at 600 people that have died of this virus. Health officials focus on faster diagnoses. Wuhan is told to round up the infected residents for mass quarantine camps. Chinese doctor who warned about the outbreak has now died. Refund for U.S.-China air travel increases to 500%. So that's how bad this thing is. So the death toll in China surpasses 600 now. And so the death toll and the number of infections are continuing to climb in China, according to the official data released by early Friday. So nationwide, more than 70 new deaths and 31,100 new cases emerged in the previous 24 hours, the National Health Authority said Friday morning. The new figures brought the total number of deaths in China at least 636, and the total number of confirmed cases is 31,000. Ooh, that's scary. 31,161. 69 of the newly reported deaths occurred in Hubei province. Now, correct me for the pronunciation if I'm wrong, but let's backtrack here. The confirmed cases rose to 31,161. It was more than 20,000, and now it is at 31,161. And now it was 300 or 400 that died, but now it's at 636 people that have died. It is climbing. So this is not a game, but the heart of the outbreak, the authorities said, but there were also 4 deaths outside of the province, 1 each in Jilin, Henan, Guangdong, and Hainan provinces. So these might be names that are foreign names of cities in China or near China. So far, the vast majority of deaths have been in Hubei, though deaths have also been reported in the Philippines, Hong Kong, and other Chinese provinces. There are also more than 200 cases of infections outside of China as well. So I can see this map, and if you want to see this article, it shows the coronavirus map tracking the spread of the outbreak. And so the virus has sickened more than 31,400 people in China and 24 other countries. That's actually more than the number that was stated up here. It was 31,161, I believe. That's what it said at the top. Isn't that what it said? It was, yeah. And so this one is saying something a bit more. So I'm going to stop there and then keep going afterward. That's what bothers me. I feel like they're not telling us everything because of the fear. They weren't telling us about Nigeria. They were closing the borders to all of these countries, and they were African countries, but they weren't telling us why. And so people were looking at this. Why is it that they're closing only the African countries? But now we're hearing they're closing other countries that aren't African as well. But I believe they were hiding this because they didn't want people to freak out. Too late. People are freaking out. And so it happens to be, I read an article earlier on, like I think it was like almost a month ago, that said Nigeria was like the economic driver in terms of business and economics in terms of, Africa being a big economic driver. And it was called the Black China. Why? Because it does a lot of business with Chinese business people. And what are we dealing with right now? Coronavirus. And so it's scary because I feel like they don't want to tell regular civilians the truth about how bad this really is. They're telling us what they want us to hear, but they don't let us know everything. This is wiping people out quick. And we don't know enough about this. I don't think enough we should know. So many doctors believe the deaths and infections in China are undercounted. Exactly. Because hospitals and laboratories are under severe strain to test for the virus. So local officials in Hubei province, the center of the outbreak, have called on the healthcare workers to speed up the process. Many sick residents in Hubei also say that they have been turned away by overstretched hospitals which lack test kits and beds. So this 31,400 might be a lot larger than that. And there might be more people that might be on the way to death, to near death, because of this. Now, I've been seeing people just like this woman you see here, covered with a mask. In Los Angeles, there's Koreatown, there's Little Tokyo, there's Chinatown. We have people that I've seen in these areas with their face covered just like this, and it's scary. And I'm noticing some of the restaurants are not as crowded because people are afraid. They're afraid now. It used before this coronavirus came up, nobody was, covering up and hiding and doing any of this. They were going to the restaurants and they were eating, and you don't see as much of that because people are afraid that maybe somebody could have traveled from these countries and be in the restaurant eating. They could be sitting next to somebody that might be infected. It's just very scary. So I've seen people driving around with these masks on, just like this woman right here, getting off a bus. And so the World Health Organization said on Thursday that it was working to strengthen the global diagnostic capacity for the new virus, saying that efforts to control the disease's spread depend critically on the ability to detect the pathogen quickly. So the WHO said it had activated, which is the World Health Organization, an international network of specialized referral laboratories to support individual countries' labs in confirming new cases of this virus. So it also said that it would ship 250,000 test kits to 159 laboratories across the world to help speed up diagnoses. And so they are scrambling, y'all, to find out how to control this situation, because it is something they're not really telling all of how bad it is. But just looking at this article, there's more to this than what we know. The U.S., the Center for Disease Control Prevention, said on Thursday that it would distribute a new test to diagnose coronavirus infections to state the international laboratories. Okay. So until now, the CDC has performed all the diagnostic tests being done in the U.S. and assisted the diagnosis of the patients abroad. Doctors have to send patients' samples to an agency laboratory and wait for a response. And the process could take days. So the distribution of the new test kits is expected to greatly speed efforts to diagnose patients. It will be sent to 200 labs in the U.S. and about 200 labs internationally. So each test kit can process 700 to 800 patient specimens. So results are available in about 4 hours. So these are some people who are patients inside the exhibition center in Wuhan that now serves as a hospital. And this is some people who have been either exposed or infected with the virus. And so a senior Chinese official has ordered the authorities in the city of Wuhan to immediately round up all residents who have been infected with the coronavirus and to place them in isolation, quarantine, or designated hospitals. And that's what you see. So Sun Shunlan, a vice premier tasked with leading the central government's response to the outbreak that is centered in Wuhan, said the city investigators should go to each home to check the temperatures of every resident and interview infected patients' close contacts. So set up a 24-hour duty system. During these wartime conditions, there must be no deserters or they will be nailed to the pillar of the historical shame forever, Miss Sun said. So the city's authorities have raced to meet these instructions by setting up makeshift mass quarantine shelters this week. So the shelters are meant for coronavirus patients with milder symptoms. So the government has said this, but the concerns are growing about whether the centers, which will house thousands of people in large spaces, will be able to provide even basic care to the patients and protect against the risk of further infection, according to a widely shared post on Weibo, a popular social media site. Conditions were very poor. So at the exhibition center that had been converted into a quarantine facility, there were power failures, electric blankets that could not be turned on, and users wrote citing their relatives who had been taken there, saying that people had to shiver in their sleep, and there was also there was a staff shortage, and the post had said this, where doctors and nurses were not seen to be taking notes or symptoms, and distributing medicine and oxygen devices were seriously lacking. So this is bad. How bad will the coronavirus outbreak get? Here are 6 key factors. But anyway, that's an article that's sort of in relation. So the quarantine comes amid a lockdown of a city and much of the surrounding province of Hubei, and that has exacerbated a shortage of medical supplies, testing kits, and hospital beds as well. So the lockdown encircling roughly 50 million people is unprecedented in scale. Experts have questioned its ethics. So the Chinese government says the quarantine has prevented a border outbreak, but Wuhan and its home province, Hubei, have borne the brunt of the epidemic, as the sudden shutdown of transportation links into and around the area slowed the shipping of vital medicine supplies. So the corona outbreak, what do you need to know? Start here. So there's a lot of literature about it because a lot of people are afraid and they want to know what to do if they come in contact or they know of someone who's come in contact with the virus. So the facility rate, it goes on to say, in Wuhan is 4.1% and 2.8% in Hubei, compared to 0.17% elsewhere in the mainland China. This is almost a humanitarian disaster for the central Chinese region, said Wiley Lam, an adjunct professor at the Center for Chinese Studies and Chinese University of Hong Kong, who cited insufficient supplies and medical equipment, food, and other necessities. The Wuhan people seem to be left high and dry by themselves. So, Chinese doctor who had warned of the outbreak, we know he now is a victim and has died of it himself. The doctor who was among the first to warn about the virus, and they tried to silence him, only to be silenced by the police, died on Friday after himself becoming infected with this virus. The hospital treating him reported. So Wuhan City Central Hospital said that at 3:48 a.m. Friday that the doctor Li Wenliang had just died himself. So we deeply regret and mourn this. It is sad news on the Chinese social media site Weibo. And so just hours earlier, the hospital had said it was still fighting to save Dr. Li, who was 34 years old. Dr. Li's death set off an outpouring of grief and anger on social media, with commenters on Weibo and Twitter like websites demanding an apology from the authorities to Dr. Li and his family. I want freedom of speech also emerged as one of the top trending topics on the site until government censors stop the messages. And so that's another thing that has happened more recently. That was why there were a lot of protests in those countries, because there's a lot of heavy censorship. When people try to have freedom of speech to say what they want, they get shut down, or the police tries to silence them worse. And so the police and others questioned Dr. Lee in early January after he had warned a circle of medical school classmates on December 30th about a viral outbreak that he had said appeared similar to SARS. The police compelled him to sign a statement denouncing his warning as an unfounded and illegal rumor. So the New York Times wrote about Dr. Lee on February 1st. If the officials had disclosed information about the epidemic much earlier, he told the Times, I think it would have been a lot better. So there should be more openness and transparency. Refunds for U.S.-China air travel have increased to 500%. And so this is what you'll see, people looking like this in airports that have to do with the traveling, and in places where they fear they could come in contact with and the disease, the virus. So demand for flights to mainland China from the U.S. took a nosedive in late January as the severity of the outbreak became clear, according to the data from the Airlines Reporting Corporation and industry-owned Transaction Clearinghouse. So sales, which were only somewhat lower early in the month, were down by 59% in the fourth week of January compared to with the period a year before, according to the data, which is based on 1.8 million tickets sold in January of 2019 and 2020. So ticket refunds skyrocketed to 534% that week, year over year. Okay. So the demand for flights to Asia showed a smaller decline of 18% in the fourth week of January, with the number of refunds to 215%. Airlines around the world have cited such declining demands in recent weeks as they have severely cut service to mainland China, with the cancellation spreading to Hong Kong in recent days. And so the air travel to China, or Air China, one of the most active nonstop carriers between the U.S. and China, cited the drop in demand this week in a request for federal approval to sharply reduce service. So in an emergency request filed with Transportation Department on Sunday, the airline said it wanted to replace its current American flights with just two routes, one serving each coast. And so one route would connect Beijing with Los Angeles and San Francisco. So the other would connect Beijing and Kennedy International Airport in New York and Dulles International Airport near Washington. The plan omits existing service to Newark, Chicago, and Houston. So in 2018, Air China carried more passengers than any other airline on nonstop flights between the U.S. and China. Of the 8.5 million people who flew on such flights that year, about 19% flew on Air China. United Airlines was number 2 with 17%. Okay, so as the coronavirus spreads through China and the government tries to respond, the world is acknowledging just how much it has come to count on the number 2 economy. The American casino operator Wynn Resorts is losing between $2.4 million and $2.6 million every day that its casino in Macau, the semi-autonomous Chinese territory, remains closed because of the coronavirus, and the company's chief executive, Matt Maddox, said on Thursday. So this week, officials in Macau asked its 41 casinos to close for half a month as they struggle to contain the coronavirus outbreak afflicting China and the region. And so 3/4 of Winans Arwenen's revenue, I may not be pronouncing that place right, comes from Macau. Okay, so Estee Lauder, luxury cosmetics company, warned that the outbreak would hit its financial results in the near term, predicting that the sales in its third quarter of 2020 would be the most affected. So it pegged this to the impact on the air travel and tourism to the key global shopping areas. American luxury brand Tapestry, which owns Coach, Kate Spade, and Stuart Weitzman, said the outbreak was significantly impacting its business as well, with the majority of its Chinese stores closed. Nintendo, Japanese maker, the video games, the gaming devices, said Thursday that the shipments of Nintendo Switch game consoles to customers in Japan would be delayed. The Yum brands, which operate KFC and Pizza Hut franchises in China, had said earlier this week that nearly one-third of its restaurants had been closed because of the outbreak. But ArcelorMittal, the world's biggest steel maker, had a more positive outlook, saying it's expected that the virus to have a short-term negative demand impact in China and to a lesser degree elsewhere, but the demand would recover in the rest of the year. So the number of Americans quarantined on military bases also continues to rise. And so there is quarantine set up on the military bases as well because of the traveling to these countries. So 2 or more flights evacuating Americans from Wuhan, China, and the center of the coronavirus outbreak are scheduled to land in the U.S. this week, and passengers will be quarantined at a hotel facility in Lackland Air Force Base in San Antonio and Eppley Airfield in Omaha, Nebraska, and government officials have said this. And so their air arrival will bring the total number of evacuation flights to 5, and the first carried 195 Americans out of Wuhan last week. And so they are quarantined on military bases in Riverside, California. 2 more flights landed in the U.S. early on Wednesday morning. 348 passengers, mostly American citizens, will be held at the Travis Air Force Base in Fairfield, California, and the Marine Corps Air Station in Miramar in San Diego. So all of the passengers have been ordered to remain in quarantine for 14 days from the time they left Wuhan. So 2 weeks is believed to be the max time it takes a person to become ill after being exposed to the coronavirus. So it says, read more about what life has been like for the quarantine people. So the virus spreading raises fears about Tokyo Olympics as well. And so that's a whole nother story. As the coronavirus continues to spread, the clock is ticking towards the start of the 2020 Summer Olympics in Tokyo, raising concerns that the outbreak could disrupt the games as well. So the opening ceremony is scheduled to be held in less than 6 months. July 24th, the Japanese officials sought Thursday to allay fears that the dangerous virus would have any effect on the game's athletes and fans. So I'd like to make it clear that there have been no talks or plans being considered between organizers and the International Olympic Committee since the World Health Organization declared an emergency, Prime Minister Shinzo Abe told Parliament. So still the threat remains. Only a few dozen cases have been confirmed in Japan, but the presence of the cruise ship off the Yokohama with more than 2,000 quarantine passengers offered an all too vivid symbol of disruptive potential of this virus. And so Toshiro Muto, the chief executive of Tokyo Olympic Organizing Committee, said it was important not to unnecessarily stir up the feeling of crisis. The Japanese public broadcaster NHK reported, but he also had allowed for a different scenario. So I am extremely worried that the spread of the infectious disease could throw cold water on the momentum towards the games. So he said this, and I hope that it will be stamped out as soon as possible. So who will host a meeting of scientists? And so these are all the people who are really, look at this room. Look at all the people who are scrambling, trying to figure this thing out. Tell me this is not serious. You're not going to have people sitting here and they're all trying to figure this thing out if it wasn't that serious. So a meeting of a new coronavirus at the World Health Organization on the new coronavirus. Oh, wow. At the World Health Organization on Thursday to help stem the spread of the new coronavirus. The World Health Organization will convene a scientific meeting in Geneva on February the 11th and all the way to the 12th, or February the 11th and the 12th, through the 12th, to focus on the speeding and development of treatments, diagnostic tests, and vaccines. At a news briefing on Thursday, the World Health Organization officials said scientists still do not know exactly how the virus is transmitted. That's creepy. Just reading this is creepy. It's like they still don't know. When you hear those words like that, it's like they're scrambling. That's why when you see this room of people trying to figure something out, you're like, they don't know what they're doing yet. They really haven't got all the answers yet. But so many people are dying so quickly. And so it says, I almost don't want to read the rest of it. So it says the virus is transmitted. They don't know how the virus is transmitted and what the spectrum of the severity is. Wow. In other words, how many people develop severe symptoms that can be fatal and how many have mild cases? And so we know it's DNA, said Dr. Tedros. Okay. I'm not even going to say the rest of that name because it's long. The Director General of the World Health Organization. We know it can be transmitted from one person to another. Great. Yeah, we know that. All of us know that. We know that those most at risk are older people and those with underlying health conditions. And so there is still a lot that we don't know, he added. And so we're shadowboxing. Wow. So the World Health Organization reported 3,700 new cases on Wednesday, a slight dip from the figure reported on Tuesday. Despite the decline, it's right now too early to make predictions about the course of the epidemic, said Dr. Michael Ryan, Executive Director of World Health Organization's Health Emergencies Program. So he warned that China is still in the middle of a very intense outbreak, and we need to be careful. Nearly 3,700 new cases of the coronavirus in a single day. Wow, in a single day. It's like when you see a zombie movie and one zombie bites another person, then that person gets infected, and then other people start biting each other. That's what this sounds like a viral, like a zombie apocalypse or something like that. I know that seems extreme, but 3,700 new cases of coronavirus in a single day is nothing to celebrate, he added. See, now, I didn't know that. In a day, I thought it was like over a span of like maybe a few months or so. No, this is 3,700 new cases in one day. That's not good at all. And so they're not telling us everything. Italy confirms a third case. All right, I want to stop. I really do want to stop. This is scary. This is really scary. So a third coronavirus patient has been confirmed in Italy. Italy? To an official with an Italian health ministry. The patient was one of 56 Italian evacuees from Wuhan who arrived in Rome on Monday and were put in a military site in Rome. 2 other confirmed corona patients in Italy who are Chinese citizens from Wuhan remain in critical condition at a hospital in Rome. where they are being treated with an experimental combination of antiviral drugs. Lazzaro Zani Hospital, which specializes in infectious disease, said in a statement on Thursday that the World Health Organization had identified the drugs as the most promising based on the available data. One drug, Ritonavir, is often used with other medications to treat HIV patients or HIV people and has shown antiviral activity on the coronaviruses, according to the hospital. Now, I did hear that they were trying to put a cocktail together, a type of drug that was a drug that they use on people who are infected with HIV. And they said it was showing some positive signs that it was actually working. And I heard that, but I don't know how efficient that is. I think they're in the early stages of that, so I'm not sure. So the other drug was a remdesivir that was developed as a treatment for Ebola, but has not yet been approved for use against any disease. So there is some evidence that it could work against the new coronavirus. And Gilead, the company that owns the remdesivir patent, has donated doses to China. So they're trying to see if they can use that to help combat this virus. With no proven cure in sight, the race is on to find an effective treatment for the new coronavirus. So in China, scientists have reported a preliminary success in treating coronavirus patients with a combination of it's called Arbidol, and an antiviral drug used for treating influenza in China and Russia, and Darunavir, an anti-HIV drug, but the researchers did not say how many patients they had treated with a combination therapy. And so their findings have not been reviewed by outside experts. So the Chinese authorities have also turned to other types of treatments as well. So they're still scrambling to find ways of trying to combat this virus. And so the World Health Organization, our National Health Commission of China, listed traditional Chinese remedies as well as antiviral drugs as well. So that was a plan released last week. And so 61 now stricken with the coronavirus on cruise ships. Wow, this just keeps getting really, really creepy. And I heard that cruise ships that are off Japan, some people had the virus. Things were looking up on Thursday, and for the more than 2,000 passengers quarantined on the cruise ship in Yokohama, Japan, meals were coming on a more regular schedule, and so the internet was upgraded to a wider bandwidth, and there was even official approval to breathe some fresh air. Still on the second day of the planned 2-week quarantine, there was a persistent concern about the spreading of coronavirus and the dread about long days ahead stuck inside the cabins of the ship. The Diamond Princess is what it's called. So as Japanese health officials continued to screen 273 passengers who were potentially exposed to this virus, they said that 20 of the 102 tested so far had been found to be positive with the virus. And so the first 10 cases were announced on Wednesday and the others on Thursday. And so the new cases involved Japanese passengers, 2 Americans, 2 Canadians, and 2 New Zealanders, and 1 Taiwanese. And so they were removed from the ship on Thursday and taken to a medical facility. On Friday morning, however, the numbers had taken a turn for the worse. Japanese Ministry of Health, Labor, and Welfare announced the number of infected passengers aboard the boat had risen to 61 people. And so 41 new cases were to be taken off the ship for medical treatment. And of the 41 new cases, 21 were Japanese, the ministry said. So I keep hearing painful coughs from a foreigner in the nearby room, and one passenger wrote on Twitter, noting with concern that the crew members were delivering meals from room to room. I might get infected today or tomorrow. Other passengers who had been uh, whiling away some of the time on social media told more hopeful signs. Wow, this is really scary. So, one noted that the supplies were being moved into the port and that the ambulances were in position. Another said that the entertainment crews had been visiting guest rooms to cheer people up, and that the toilet paper had been distributed, and some posted a letter that had been delivered to their rooms saying that the ship was negotiating with Japanese quarantine officials to allow small groups with face masks to breathe air on open decks. So China warns Taiwan not to use the outbreak as an excuse for independence. And so it gets really crazy. So the Taiwan president, uh, Tsai Ing-wen Center, inspecting the mask factory in New Taipan City, Taiwan on Wednesday in a photo release. So I guess here's some mask, and there's more mask here. Some other things. The China government on Thursday accused Taiwan governing party of exploiting coronavirus outbreak to push Taiwan's independence, referring to its effort to participate in the World Health Organization discussion over the outbreak. So Taiwan, which is self-governed but which China claims is part of its territory, has repeatedly lobbied to be included in panels held by the World Health Organization, the United Nations Health Agency. The World Health Organization cannot share information about the virus independently with Taiwan because the United Nations considers it part of China. So Taiwan independent separatists have seized on the opportunity to clamor for participation in the World Health Organization discussion in an attempt to use the epidemic to expand the so-called international space of Taiwan. Read a statement from China's Taiwan Affairs Office on Thursday. So an exclusion of Taiwanese medical experts from international public health meetings during the SARS epidemic of 2002 to 2003 had hampered prevention efforts, and Su Yi-jian, the former Director General of Taiwan Centers of Disease Control, so two sides of the Taiwan Strait must extend olive branches at this time, put aside political considerations, and work together to fight the epidemic. He wrote that in an opinion piece for the Times. So the Taiwanese government has been taking tough measures to prevent the virus from infiltrating its borders as well. So the health officials on Thursday banned all international cruises from the ports after a 60-year-old Taiwanese woman contracted the virus on a cruise ship now quarantined in Yokohama, Japan. Okay. So this is really crazy. China clamps down on the coronavirus converge as cases have surged. Why the new coronavirus mostly spares children. These are related articles, similar articles. In coronavirus, China weighs benefits of buffalo horn and other remedies. So that's crazy. I mean, it just seems like it is very scary because they really are in the early stages still of trying to figure this thing out. But it is like in one day, 3,700 people, new cases in a day. This is really bad. It's like I said, they have tried to keep this quiet because of the fear. But I think people should be in fear Anytime something can kill that many people in that short a time, or infect that many people, let's say that, in that short a time, that's something to be afraid of. So I see a lot of people wearing masks like everywhere, like wearing them even in their car with the windows up. It's crazy. Here in LA, I've seen a lot of that, and so I don't even like, what bothers me is that they waited to say this. I mean, like the doctor, like, oh, we could start from there. They tried to silence him. He was warning about this virus, and they tried to silence him, and now he's dead because he came into contact. He saw how bad this was. How many more other people have tried to warn us about things and they've been killed, murdered some kind of way, or they died trying to fight the thing, like this doctor. He tried to warn people and they tried to shut him down. What if they hadn't shut him down? What if they had to let him speak? How this probably would have helped a lot of people, maybe a lot. It would have been a lot that would have been said, and that maybe they could have been researching this a lot sooner. I don't know. What do you think about this? But it just doesn't seem like it's getting any better. So, in having said that, I'm going to let this video go, but I'm seeing a lot of people that are like this woman, walking around, driving around with a mask on. And could this be even worse? Could this get even worse to where it's spreading so rapidly that it could go to other states, and then more and more people will become sickened by this? That's the fear. Having said that, thanks for listening.